Well, speculation is rife about what the government plans to do next in the fight against COVID-19. Of course, tonight we'll be hearing from President Cyril Ramaphosa. He's expected to make some announcements in terms of the latest regulations then that will govern the country's fight against the pandemic. The speech comes as the country prepares to roll out a historic COVID-19 vaccine inoculation program. It's targeting at least 40 million South Africans by the end of 2021. COVID-19 infections in the country have been on the decline in the past week, with recent daily recorded cases averaging around the 5,000 mark. South Africa's overall recorded death toll has surpassed 44,000. Our senior politics reporter, Ziyanda Ngobo, is at the Union Buildings and she'll be watching then that address from the President. Ziyanda, a lot of expectation, at least coming through from those who are now at the point of frustration when it comes to the restrictions imposed as a result of the lockdown. Of course, a lot more needs to go into deciding whether or not those bans, those restrictions can be lifted.
Absolutely, and a lot rests on what the numbers are looking like at this particular point in time. And we know then that we are currently sitting at an average of around 4,500 infections a day and just over 200 deaths a day. This is in stark contrast to what we saw just over a month ago during the festive season, where at some point we reached over 21,000 infections in this country. And so with the arrival of the vaccine earlier this afternoon, and with the president actually conceding that there wasn't the greatest of communication in regards to the vaccine rollout plan, and juxtaposing that against the pressure that the National Coronavirus Command Council and the president have been facing, especially when it comes to the ban on liquor, you would assume and safely assume that the president will be lifting the ban on alcohol later on this evening, and that the restrictions on visiting parks and beaches will also be lifted. And in light of the fact that schools are also opening, some opened today, that the issue of actually opening up certain other public spaces would also take place this evening.
Ziyanda, the issue of vaccines and this escalating number of COVID-19 cases is what has dominated the conversation right now. But we know that beyond this, we're facing a situation where the country's economy is in dire straits, and we need a concrete plan for how we're going to get through this with as many people as possible across the line still in good shape. How much is resting on the president to be able to pull through with his plans around the economy and to really give confidence to South Africans that, yes, while plans are being made for this vaccine and the impact that that will have, the reality is that the work should be happening, in parallel and simultaneously, not really a stop and start process.
You know, one of the things that I think South Africans will be wanting to hear from the president this evening is more detail in this vaccine rollout plan. Now, we know that Dr. Zweli Mkhize, the health minister, has been trying to reassure South Africans of the vaccine rollout plan, the reliability of this particular vaccine, and the fact that the vaccine will get to the people that it needs to get to after that 2-week quarantine in Bloemfontein. Now, one of the things that the president needs to attend to is the confidence in the vaccine, in light of the fact that there are livelihoods on the line, especially in the liquor industry, where we know that, for an example, the South African breweries has had to let go of 5 billion rands worth of investments, and a lot of that has been blamed placed squarely at the feet of government and their lack of planning when it comes to saving lives and saving livelihoods. So this balancing act that we've been hearing the president speak of, now we add adding the vaccine into the mix. And of course, as you've mentioned, it's not just the stop and start issue that we need to be faced with. It needs to be a holistic approach. What are the hospital trauma units looking like? What are the hospital admissions looking like? The pressure on the health system in the various provinces, where KwaZulu-Natal, for an example, is still a cause for concern, but also looking at the ailing economy and the jobs that have been lost and the plans thereof. We saw the president speaking at the Nedlac Labour School, which is of course then made up of the 3 labour federations in the country, and we know that the president has also faced political pressure from the likes of COSATU, who have really criticized the president and the NCCC for not being able to tread that rope quite carefully when it comes to balancing. So certainly in terms of seeing that ban being lifted, I can safely assume that this is absolutely going to happen without a doubt, and that when you look at the justification then for some of the regulations in the adjusted level 3 of the regulations, that some of them need to be lifted in light of the numbers that we're seeing at this particular point in time.
All right, Ziyanda Ngobo, we're going to leave it there for tonight, and that the President's address, of course, gets underway at 8 o'clock. We'll bring you live coverage here on Newzroom Afrika. We'll also get your reaction to part of what the President is set to announce this evening.